Saffron is a supplement for mental health. Is it worth it? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about the importance of providing holistic care and targeting root causes of mental illness. And if a patient comes into the clinic and tells me that they want to try a supplement, as long as there are no safety concerns or significant interactions, if that's something they want to do, I generally support it. But I also think that it's important to be aware of what these supplements are used for, what their potential side effects are, and whether or not they actually have any likelihood of symptom relief. So first, let's start off by saying that the therapeutic dosages that we would use in a saffron supplement are much greater than what you would consume in your diet. One, because saffron is the most expensive spice that we have, and usually it's used in really small amounts in cooking. So a lot of studies use 30 milligrams when looking at saffron supplements, but certainly doses up to 200 to 400 milligrams can also be used, and it's generally considered to be relatively safe as long as it's kept below the 1.5 gram upper limit. It can be used for major depressive disorder, as well as reproductive issues and sexual dysfunction and Alzheimer's disease. Now, we don't fully understand the mechanism behind it, but some of the thoughts as far as its antidepressant effect is that it may act as an NMDA receptor antagonist. It may improve BDNF, which is basically like growth hormone for the brain, and it may inhibit the reuptake of monoamines like norepinephrine, dopamine, and serotonin. It also seems to have anti-inflammatory and antioxidant effects, which plays into why it may be helpful with those who have cognitive impairment. And it can help to lower blood sugar levels and reduce appetite, so it may be helpful from a metabolic standpoint as well. As far as depression, we do have multiple randomized controlled clinical trials to show that saffron can be pretty effective and well tolerated for major depressive disorder. There have been studies to show that it's essentially as effective as imipramine, which is a tricyclic antidepressant, and fluoxetine. As far as Alzheimer's disease, there has been evidence to show that it's as effective as memantine, which is one of our Alzheimer's disease medications to slow the progression of the disease. Now, this isn't saying a lot because memantine is not terribly effective, but it's certainly something to consider. And traditionally, it's often been used to help with sexual dysfunction and reproductive issues, and there is some evidence to support its use in these indications as well. As far as safety issues, like I said, it is generally well tolerated, but some side effects can include things like nausea, vomiting, headache. There can be dry mouth and decreased appetite, as well as a reduction in blood pressure. It should be avoided in pregnant women as well as in people with bleeding disorders because it can slightly increase the risk of bleeding. One of the things that's really important to think about is interactions with other medications. So like I mentioned, it can increase the risk of bleeding. So I would generally not recommend it if someone is taking a blood thinner. It does have some serotonergic activity, and so it can increase the risk of serotonin syndrome if taken in conjunction with other serotonergic agents like antidepressants. Because of the drop in blood pressure, if someone is taking blood pressure medications, then it could potentially lead to their blood pressure getting too low and causing dizziness or syncopal episodes. And again, it can decrease your blood sugar. So if someone is taking a certain type of blood pressure medication, then there is a chance that your blood sugar could get too low. It can also be a little sedating, so that's important to keep in mind if someone is taking other sedating medications like sleep aids or benzodiazepines or gabapentinoids. And lastly, it can slow down the metabolism of caffeine, which can make the effects of the caffeine more intense. So someone may need to consider adjusting how much caffeine they consume if they're taking a saffron supplement. Of course, one of the biggest downsides is the cost. It's going to be a pretty expensive supplement because it's coming from the most expensive spice. So what about you? If you've had an experience with saffron, either positive or negative, I'd love to hear about it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.